first panel of the day, really excited to introduce, is entitled Bringing Equitable Products to Market. If you're online, for those of you, please go ahead and jump to the next virtual section, just like you would have done previously in either day 1 or day 2, and you can navigate to it just by clicking on the title of the session on the left-hand side of your screen. And so with this conversation, I have the pleasure to once again welcome Mike Cleghorn as the moderator. I'll give a bit of an expanded bio for Mike now. So again, he's the Chief of Provincial Digital Solutions at PHSA and has worked exclusively in healthcare across public and private sector roles for over 20 years. In his current role, he oversees clinical and business enterprise digital health products and services across PHSA and partner health organizations provincially. Previous to PHSA, Mike had diverse IT leadership roles at Alberta Health Services for over 12 years. With this role in the pandemic response in Alberta, Mike was also recognized in early 2023 as a recipient of the Queen Elizabeth II's Platinum Jubilee Medal for Alberta. With that, I'm going to hand it over to Mike, and I see our panelists have joined us.
Thank you, Tina. Good morning again, everyone. So we have an empty chair. So if anybody sees somebody looking probably pretty frantic, maybe running from the subway, he's probably running up to the to join us on the panel here. So good morning, everyone. As most of you who know me, I'd love to keep this pretty casual so that we have this very interactive. We will be seeking questions from the audience here in person, as well as online. So don't be shy. There'll be a roaming mic available to us as well. So I'd like to introduce my panelists and give them a chance to introduce themselves here a little bit. So at the far end, we have Don MacArthur. And Don, why don't you just introduce yourself here?
Oh, hey, everybody. I have been working in digital healthcare products for about 25 years. I did 15 years of that in Alberta, the last 10 here in BC. My background is mostly in technology, but more and more we talk about change management more than anything else. For the last 10 years, I've been deeply involved in creating new technology around digitally enabled and FHIR-enabled interoperable provincial clinical registries. So we've been spending a lot of effort on that. I also hold down a position with Team and Managed Services, where I am the Chief Innovation Officer. My title with PHSA, although not important, is I lead the development for the Health Toolkits project under Connected Health under DHSI.
Awesome. Thanks, Don. And for better or worse, Don got to work with me in Alberta a number of years ago. Next in line, next closest to me, we have Amir Javidan. Amir.
Hi, everyone. I'm Amir Javidan. I'm the Chief Operating Officer at Well Health, and I oversee the product and technology strategy for the organization. I'm involved with working with different parts of our businesses. We have a few different business units. And Well Health, just a bit about us. If you haven't heard about us, we operate a network of medical clinics in Canada. Ooh. Is that okay? Is it okay? And we also have a number of different digital health solutions that we offer to clinics and providers, but also heavily utilized in our own clinics. So we've had kind of our whole reason for existence is really all about helping digitize healthcare, and we've made some great inroads, and looking forward to sharing with you all.
I've just noticed that Brian is here. He's with us online. So how dynamic is that? I love this, that Brian's actually there living the virtual aspect of the panel. So we'll get to Brian here after we hear from Hamid.
Hello, everyone. My name is Hamid. I'm Hamid Farshchi, CEO and co-founder of D2Type. My background is medical scientist, MD, PhD, and in clinical nutrition and metabolism, and subspecialty in endocrinology and diabetes management. Working in a clinical setting and in academia for more than 20 years, and having a record of more than 75,000 patients in the clinical setting, in person and virtually. And we have brought this experience to our startup in digital health. It is D2 type. It is a startup for managing diabetes in terms of empowering people at risk for diabetes. It means having prediabetes or diabetes to prevent, delay, and reverse type 2 diabetes. It is combining life coaching with digital tech to empower this group of people and make it scalable and equitable for the people living in remote areas especially. It is the things that we are proud to work with the healthcare system and with the different stakeholders to make it accessible for the people at risk.
Awesome. Thank you very much, Hamid. And Brian, are you able to contribute?
Yeah. Can you guys
Awesome,
hear
Brian.
me?
We can hear you extremely well. Yeah, go for it, Brian. Thank you.
Awesome. Well, I'm not that far away, and I did think about running down the street to be there in person. Yeah, Brian Simmers. I'm the Chief Financial Officer and VP Health Informatics at Providence Healthcare. I'm also responsible for our corporate development, which includes our for-profit ventures arm. My background is spent the last 5 years in healthcare at Providence, but before that, was in another public sector role where I was responsible for IT and finance. I helped develop and deploy an AI system in a production environment to help with safety inspections. And before that, I was in the startup world and part of a number of companies that were kind of created in the software and technology space. So kind of bring both together. Excited for the discussion today.
Thank you, Brian. All right, so
really giant there.
So what we want to talk about here today was how to bring equitable products to market. And I think the diversity of the panelists, so thank you for sharing where you sit and what your interests lie. We're really trying to say this. So what does equitable mean? What does it mean? We talked about engaging patients and providers. So what does it mean? So I might just start by asking Hamid to how would you describe what equitable means in this context of digital health?
Actually, when we speak about the equity in the healthcare system, it means that we can provide the fair access and just distribute to anyone, regardless of their social economy, background, their geographical location, gender, ethnicity, and anything that make barrier to get the service. And especially after the pandemic, it is a good experience that the general population have more trust to get access to the digital healthcare. And also there is more self-confidence in the healthcare system that can combine these together. When we speak about the health status at the current situation, that one of our main difficulties is managing chronic disease. Even for the pandemic, you know better than me that people at risk for chronic disease, including diabetes or cardiovascular disease, are more at risk for getting disturbed with COVID-19. And it is the reason that we should provide these services, but make it accessible for the people in different groups. And it is the thing that the art of digital technology can help to provide these services accessible for the different group of the people.
Awesome. Thank you. So if for those that heard the my opening comments was around equity and equality, so I hear you, and there's lots of challenges, so we're trying to address which some of these aspects were quite foundational to actually the Canada Health Act itself. There's pieces there that we need to honor, and we can do so more with technology. So, Brian, how would you reflect on that? Any experiences you can offer to build on what Hamid said there?
For sure, yeah. I think there's one area in particular I wanted to drill into and we have some experience at Providence with this, and that's kind of that geographic access. I think we know that a lot of specialists choose to locate in dense urban areas, and it's often hard to get that expertise out to the more rural patients. And so we participated with a number of industry partners to create a solution that uses a handheld ultrasound device. It attaches to a cell phone. It can be used by a rural practitioner to take images. Those images get loaded into the cloud where they can be accessed and assessed by someone, say in St. Paul's, and they can do the reading. They can be on the phone at the same time, providing feedback. That platform also allows for the application of AI to help kind of speed diagnosis. We did something with a dermatology application, very similar, same kind of network and structure, but looking to kind of speed up the identification of potentially cancerous moles to then get that treatment done faster. So taking kind of that scarce resource, which is like the reading resource, finding ways to use it more efficiently, like you were mentioning about the provider experience, but then we have examples of like people in Haida Gwaii getting their images read in real time in Vancouver. So I think that's one way that we can use digital, because it doesn't really care where you are, like me today, and we can use that to help make things more equitable.
Thanks, Brian. So we're trying to unpack here, what does it mean to bring equitable products to market? And so equitable, we've heard from that. So let's talk a bit more about products. What is a product? What does a product mean to us, mean to you? I'm sure we have different interpretations of it between the context in which we can use it and consume it, whether as provider on the provider sort of side or on the citizen side of things. So Don, what do you consider to be a healthcare product?
That's a really large question to unpack, but I'll give it a shot. I think for any of you that have known me or worked with me over the years, I tend to think in ecosystems. So it's, to me, the product is in fact part and parcel of the ecosystem. But I did dig up a Tech Target article from a while back that I think says a couple of really interesting things about it. So of course, the digital health products include things we know, mobile health apps, electronic health records, EHRs, electronic medical records, EMRs, wearable devices, telehealth, telemedicine, and personalized medicine, which is a very interesting and new development over the last 5 to 10 years. In that ecosystem also, I think we should acknowledge the stakeholders, because the stakeholders in the digital health field are varied. There are patients, practitioners, researchers, application developers, medical device manufacturers, distributors. Digital health actually plays a very big role in all of that. And I think when we talk about the ecosystem, it often falls down to two different types of products. You can think of it broadly as the business to business side of things and the business to customer side of things. So obviously the business to business side is the healthcare system itself. What can we do to help the practitioners and the folks who are providing care in the front lines, point of care, to make their lives more efficient and to provide better care? Here's an interesting thing from Deloitte Insights. Digital health employs more than just technologies. And here's some of the stuff I really like about what they said. It also views radically interoperable data. And I think you're going to hear that all day today. And that's a big topic from where we work at the Connected Health System. Artificial intelligence, open, secure platforms. These are all central to the promise of consumer-focused prevention and performance-oriented care. So to me, that's the ecosystem we're talking about.
Thanks for the references there, Don. That's great. And so I think we're going to tap into that ecosystem thought process here a little bit. Amir, tell me what you see as part of this digital health product space, reflecting on maybe some of Don's comments.
Yeah, I think Don captured it well. I think in terms of thinking about different types of products, digital health products. one of the ways I've liked to think about digital health and different types of solutions for healthcare is thinking about certain solutions that are really a digital equivalent to an analog. So you have some solutions that are, for example, an EMR. An EMR, really the last, I would say, 10 to 15 years of if you think about the trajectory of digitization in healthcare, was really focused on the pain around getting from paper records to digital records. And that was a long journey. It was a painful journey, but it also, we haven't really harnessed the value of having a digital record yet. And I think in a really substantive way. And so I think we're very much at the early innings of this next era in digitization in healthcare, which is about how do we actually put that data to work to be able to help drive more efficient workflows, to be able to help provide clinical decision support to providers, and really giving them almost superhuman abilities, right? And we know that the providers are really the heart and soul of the healthcare system. And so how do we magnify the output of what they can do? And so going back to what I was saying, I think there's some solutions that are just the digital equivalents, like EMR, paper chart to digital. There's things like online booking is very important and powerful, but it's really replacing calling into an office or calling into a hospital and having to book something. And those types of solutions are very important, but I think it's really just sort of a foundation. But there's other solutions that I think are really much more step function or orders of magnitude, higher impact than just thinking about the analog equivalent. So, for example, being able to leverage data in healthcare to really drive clinical decision support for providers, identifying, and detecting early stage diseases. These are things that just weren't possible, right? And I think there's a lot of solutions like that. We're seeing certainly some very interesting adoption of AI that is really making a big impact for providers. We're seeing, we've got a few hundred providers now that have adopted our ambient scribe solution that, providers are using it and then saying, well, I just can't imagine going back to the way I used to practice medicine. It's just being able to have 30% of my time back, being able to focus on the patient and not have to worry about charting. So these are, I kind of think about digital health as there's the baseline, yes, replace the analog equivalent, and then these sort of orders of magnitude, solutions that are, I think, a lot of what the next era is going to look like. So,
thank you. There's a lot to tease out of that, right? Like, knitting together with some of the other, comments around this, what does equitable mean? And you've raised a couple of points around the provider side of things, right? Like, and the whole EMR transition that you mentioned. For those of us that you've been in the industry for long enough to have lived through that and the pain and the struggle, but we all had the same objective and we all knew how painful it was, but we're all trying to do it still. And it was like, right? I hope that gentleman's not burned. Are you okay? Sorry. So we're now at a point now to say, okay, we all have the same objective. We're all trying to do this, and we have to make sure that this is equitable. So equitable comes in the form of not just patients. Like that was the way I was initially thinking of it, was like the patients access, like Brian spoke to, in Haida Gwaii. But now we're talking about, well, providers. We have providers that don't have the tools that they need. So how is that impacting their ability to provide the best care that they're striving so hard to provide, right? So how do we enable that? The equitable aspect in digital health has to be supported by the whole ecosystem that Don reflects on. So Brian, I'm just going to maybe turn it over to you to talk about, reflect on these comments. So what does equitable digital healthcare products look like in your organization, in your context? And if you can even comment where you're trying to go.
Sure. And I did want to say, I think after I talk, I'm just going to turn my camera off, and when you want me back, I'll magically appear. It's just too weird.
I think but this like 7 foot tall head is amazing. It's like in those, the sports games where you see people have those huge heads. Yeah, you kind of that. Anyway, so over to you, Brian.
No worries. Yeah, I mean, I thought of this in more simple terms, and I came to healthcare, thinking that it would be easy to fix, that, there's just a few tweaks here and there and everything could be connected. And really what I think, like, if we really want to make this kind of equitable in terms of like, so when I also think about like, accessible for companies of all types and sizes. Not every company has the resources like to be Oracle or Cerner or whatever, and maybe engage with the government at like the highest levels. You have a startup that's got an idea, they have an opportunity that could make a small improvement. For me, it's about creating and exposing bi-directional APIs and having standards that we can allow for companies to participate in the ecosystem, but then for us to be able to absorb that information or that content into, let's say, a unified patient experience, a unified clinician experience. So for me, yeah, it's just about opening. And this comes from, like, I've been a startup trying to sell into government, and the most time-consuming, confusing part is you can't figure out where or how. No one can point to a way for you to participate in the system. And so I think if we could get clearer about that, like, this is how you can, these are the forums, these are the ways, but here's the minimum requirements. And we set that in such a way that it's not just set up for the very large companies to come in and sell to us. So some thoughts from my perspective.
Thanks, Brian. I might just maybe ask Amir to comment on that, given that you talk about getting into the healthcare system. And I remember at an eHealth conference, probably going back 5 years, there was an interesting panel that was basically a bunch of entrepreneurs that were really passionate to say, we need to be given a chance. And that chance, I think, is like the pandemic helped spur that. So Amir, as you have been working to grow an organization that's really diverse in its offerings, where do you see this equitable products in this context, in supporting the broader healthcare system sort of getting in, like Brian mentioned?
Yeah, so our journey was a bit unique in that we have technology solutions, but we also have clinics. And part of the reason that we took this approach was that we were finding it was difficult, and we understood it was very difficult to, as Brian mentioned, it's one thing to have a good digital health product, but to get it adopted, to get it in place, and however it is that you end up being able to sell it into place, actually the adoption and the ability to help providers, if it's a provider tool, helping them become successful with it is just as important as how good the product is itself. And so we've sort of taken this approach of being able to operate our own clinics so that we can pilot early, to have our doctors really inform what's being built, and be able to then quickly pilot and roll it out in a phased fashion. And that's really helped our ability to drive adoption. I think the one of the ways we think about equitable access also is just how do you, the unfortunate circumstances we have in our healthcare system broadly is there is a massive, obviously, shortfall in provider supply. And so what that means is, you do have patients in some cases that may have trouble accessing care. And one of the ways we think, we can help support that is to just increase the provider supply and increase the capacity that, providers have in terms of being able to deliver care, and doing that through digitization of the provider experience and the patient experience, equipping patients to be able to help self-serve where it's appropriate, to be able to get them connected to care. Your traditional experience of having to, if you need to go see the doctor and booking time off work and waiting in the waiting room for a long time, and there's ways to make that less of a burden and be able to get patients, being more proactive about their care. And we know, of course, the more proactive patients are, the better the outcomes. So that's some of the way we think about it.
Thank you for that. I love the idea of being proactive in your care, right? We really broke down the walls of that like area, that subservient kind of, I'm subservient to the provider of my care. And that comes in various forms. I hope don't get too many eye rolls here, but with respect to like the security and privacy of our data, it's like, but it's my data. Why is it so hard for me to get or have that inform me in my decisions, right? So it's really interesting to be able to say, that paradigm shift. And we know that we're, in a very complex and dynamic environment. So we have to sort of be able to nudge a lot of things along the way, so that people can really feel empowered in delivering their own care in an equitable manner, wherever they are geographically, just there's lots of barriers, and so if we can help find a dynamic way in the way that you've described here, Amir, is impacting the health system in different ways. So, Hamid, question for you about what does this equitable and digital health products look like in your context?
Actually, when we speak about the nature of the world that we live here now, it is a transformation in all of aspects. It means that the nature of the disease is transformed from the acute to the chronic disease. And also the nature of the life for people is has been changed. People are involved with their busiest lifestyle. They don't have time to go in person for visiting the health professionals. And also, in the other angle, we have difficulties regarding to the human resource and access to the doctors and health professionals. It means that we should work together to provide the things or the tools that anybody in the any stakeholders can get benefit. One should be the party, any users or any patients or anybody needs to have access to the health services. The other angle should be health providers. And the other part should be about the regulation and standard of the care. It means that the governmental sectors or the healthcare system, they want just to have provide the service that is more standard. In these three angles, we need to have the collaboration between these group of people. For any product that you can present or you can offer to the people, first of all, should be the users. If people don't trust to the service that we provide, they couldn't be engaged, they couldn't be commitment to any instruction that you provide. And from the other side, the healthcare provider, if they don't have access easily because they are not going to change their mind. It needs to have the connection between these group of people, the collaboration between the healthcare system, healthcare providers, users, and one of the things that we didn't realize previously because they are coming, especially during the last decade, should be provider of digital health platforms. All of them have different brain mapping, okay? And it needs to work and practice and more trust to provide this equitable for everyone.
Thank you. Don, your thoughts?
Question. Yeah, I mean, I'm sort of one of the representative geeks up here, so I'll speak at it from a more product development point of view. I mean, we strive very hard to become human-centric, patient-centric, user-centric in our development processes. That's not just lip service. We do things at the very beginning, like try and evaluate, do we have enough archetypes, personas of the users, which Hamid is saying there. We really need to become centric about who we're optimizing for and how we do it. So, I mean, given that, I think I can give a couple of examples of both provider experience items and patient experience items. Recently, we have been working on a lot of Smart on Fire apps, which are very provider centric. Now, those are things that plug into EMRs and ecosystems that allow you to get access to functions and data which you might not normally have either through your privacy and security. And I did want to shout out to our very close friends in privacy and security. You're doing a wonderful job, and We respect everything that you do. And lately during the pandemic and afterwards, there's been a market shift to what's the amount that we need that allows us to get our jobs done. So privacy and security is very important. So I don't want to skip that part. I think the question we ask ourselves is, well, who are we optimizing for? And if I looked at our processes today and I said, well, what can we do better? I would say the thing we can do better is, who are we not optimizing for? Who did we leave out? So in examples for provider experience, which is very much a business to business type development environment, you have a varied group of people using the system. There's the user experience of how they would understand the system. How easy is it to learn? That's pretty basic stuff, but there are lots of other things. Is the color set you chose appropriate for the environment? What a GP is going to use in their well-lit office is going to be different than a cath lab technologist is going to use in a darkened room. Those things make a big difference in how well they can do the job and how they can approach it. So I think those things, and then the last piece about provider experience is really thinking about their workflow, because this is the thing where efficiency really rules all. And I think we're all touching at the same different parts of the elephant, but saying the same thing. We're saying, look, we understand there's a limited amount of healthcare provider bandwidth out there, and the more we can enable that not to be caught up in adapting to technology and having it work the other way is a lot better. So I think that's a pretty consistent thing that we've all been doing over time. I will say on the patient experience. Now this is very interesting. So a lot of my career has been around the provider experience, but the patient experience things we've been working on. So last year, a different team I was on outside of Connected Health built the clinical registries team platform PRISM. And one of the registries that's in there is the organ donor registry. Now the organ donor registry, I think you're probably all familiar. It's about getting citizens to commit to a decision about the use of their organs after an untimely event. So that's a very interesting thing. Now that's a much wider group of people than the 17,000 physicians or 90,000 nurses or 20,000 allied health in the province. Don't quote me on those numbers. I may have just made those up. And so when looking at it, and this I think is more of the discussion of the ecosystem. So we built an online form. The online form is built for high visibility, for low sight. You can translate it. We can tie into a lot of functions that help people. But one of the things we realized is that when you're taking data in a secure and private manner, there can be a very high barrier, digital barrier to adoption. So we love BC Services Card and the ability to identify folks so that we can share data, but we realized that we didn't need to put the bar that high. And in organ donor, you want every application, every piece of paper that comes in and says, these are my decisions, you want that data. You don't want to filter it out. You want to make sure that data is right and that you get that data in there, because that could mean the availability of an organ to save somebody's life. And that's important. So what we realized was the process was just kind of backwards. Instead of having a high barrier to the patient proving themselves to us prior to filling out that form, we just let them fill out the form and we do the work. We use cloud services, we use machine learning, we use some interventions when we can't cover that off, some actual manual interventions to make sure that we get that data, because it's so very important to us. So in that case, it wasn't a technology solution as much as it was a process solution.
Thank you, Don. Man, there's so much time packed in. You guys are fantastic. There's a question online that I actually think kind of blends into the next question that we were going to address, and is around how to do this. So I'm going to read this question brought from online. So thank you for the contributor, and ask just any of the panelists to jump in here with a response. Could you highlight any notable partnerships or collaborations that played a critical role in the success of the ventures you all spoke about? Thanks, Amir. Go ahead.
I could share a little bit. One of the solutions that we've seen great success with is electronic referrals and e-orders and e-consults and the ability in particular for electronic referrals to really dramatically change that interaction in the patient journey between GP and specialist. Obviously, I think, we're very excited about the potential to collaborate with BC on that, but having seen it play out a few years ahead in Ontario, the impact it's making is pretty dramatic. So, for example, a 52-day reduction in wait times to see, for surgeries as a result of just being able to optimize the pathway of referrals from GP to specialist. And the software itself and its ability to orchestrate that referral, not through fax, but through electronic means in itself is not rocket science. But the hard part was, similar to what Don was saying, was actually the process around it and the ability to actually drive adoption. And, if you have, you can't really get that solution in place in a province unless you are partnering with public sector to help drive adoption, both from the GP side and the specialist side, because, in any two-sided network, the value is not there unless both sides are participating. And that's a hard thing to get in place. It's not the technology that's critical to make it happen. It's actually the ability to drive adoption and roll that out. But once it's there, once you hit that critical mass, the impact it makes is pretty tremendous. So I think that's just in my view, a great example in our experience of how collaboration, as you mentioned, between different stakeholders can help really make a difference.
Awesome. Thanks, Amir. So ask another panelist then, what would be some of the barriers to this effective collaboration? What are some of the barriers that we're seeing that we're either addressing or still haven't really been able to address? And maybe pull the audience here for some reflections. Barriers, challenges.
Well, I guess I can take on some. I think. Sorry, I cut off Brian. There.
Yeah, thanks. Yeah, go ahead, Brian.
I mean, I think I often think about the healthcare system as one of those child's games that had one square free, and you have to move the squares around in order to create a new picture. We find ourselves really constrained with money. I was actually going to answer the question before. It's really, the best partnership is money. So organizations that can bring that to bear. So our foundation in particular has been really key to help kind of provide that one square of flexibility to allow us to start moving things around. And the Ministry of Health has done a great job with the innovation pathway as well. Again, just a little bit of grease to kind of allow us to move a few pieces. So that was kind of my response to that question. But I mean, other barriers, I think it is really that, I spoke about access to the systems, but then it's access to the clinical expertise needed. I think Amir mentioned about, buying practices in order to gain access to the people that were actually using it. So that expertise is something that I think can be a barrier. The other piece is data and access to kind of historical data. You want to train an AI, or you want to assess the impact of something. So I think that's another area where helping organizations and people with ideas get access to the right experts and the right data can really help.
Need to.
Do you want to use this one?
Yeah, sure. Thanks. Money to grease the wheels, as you said, and then the data to support that, huh? Okay, I just kind of got the 5-minute signal, so I'm going to ask each panelist for about a 1-minute response to this question. And honestly, I feel like it's been a really rich discussion. So thank you all for your contributions. I'm not sure exactly which thread to tease on here exactly, so that's why I'll give you 1 minute of liberties here. So let's just start at the far end. Actually, let's start near, because we started at the far end here. So let's start here to say, what are or is the most critical changes that needs to happen in order to really effectively make this digital transformation to equitable availability of products?
I think the most important thing is that we can make it practice collaboration between different stakeholders. We believe anybody from the different angles feel that we need to collaborate, but in the practice, we are just involved with all traditional method that we use. Healthcare providers are used to have patients coming in person, even after the pandemic. The pandemic shows that people can trust and can involve with the digital services. But after that, we are going to go back again. It is the main things. And from the other part, from the healthcare system also. Healthcare system believe or mention anytime that we want to make transformation to make it accessible services. For our own practice, you know that in 2017, there is an agenda that is approved by the parliamentary in the federal status that mentioned, okay, by 2021, 90 people suffering from diabetes should be recognized. 90% of people get benefit from the best practice, and 90% of these group of people can manage diabetes by 2021. None of these 90% happening. It is necessary to make it accessible and scalable services. The traditional method is not going to be used. When we speak about only diabetes or pre-diabetes, 11.7 million in Canada suffering from diabetes or pre-diabetes.
All right, so we have to really collaborate. Don't just give it lip service. We actually have to be able to mean what we say and execute on that, because the targets that are put out there, we're not meeting, and then we're doing something wrong. All right, Amir.
Yeah, I'll just add, I think when I think about the journey ahead, two things really come to mind for me that I think are really huge impact and significant leaps forward. One is what Don mentioned earlier, and it's obviously a common theme, is just true interoperability in the healthcare system, and you know, that whole transition from paper to digital charts was great, but you know, this data has been locked in there and traditionally hasn't been free flowing, and so I think achieving true interoperability and what that drives in terms of the ability to then put that data to work and to be able to have systems talk to each other, you know, that I think is a really sort of significant area of hope ahead. And kind of related to that, I think, is the power and impact that AI can make, and the ability to really do things that are orders of magnitude better than what was being done previously. And you know, I think those two feed off each other, because you're not going to be able to get AI solutions in place without you know, the benefit of interoperability.
Love it. Thank you. All right, 1 minute for Don and then 1 minute for Brian.
I would say that I'm in violent agreement with my panelists on most of this. For me, so then I'll try and take a different stab at it. I think if we were the movie The Wizard of Oz, that we can all agree that we have heart. I think we can agree that there's a lot of intelligence in the room. I think if we could make one thing better, is to have the courage to innovate. It's the courage to fail. A lot of people hate hearing this thing, but the way that we really get a solid product out the door is to fail fast, fail a lot, correct a lot, and find that way to chart the course. This is a journey. It hasn't been done before. We're learning new stuff every year. Look at the course of I look at the course of the last 25 years. It's an insane difference from trying to tie EHRs together and EMRs together to how can we get AI to look at, you know, natural language programming, and all of these things are amazing. But for me, as running a team, is we have to have the bravery to try the things. You can't have a guaranteed success every time you do it. What we do is find a thing, make a thing, and then make it better.
Love it. Fail early, fail often, fail fast, and correct. Love it. Brian.
Yeah, thank you. I think for me, it's a mind shift. You know, BC has a lot of technology, people, companies. We have this amazing opportunity. We could create technology that we actually export. And you want to really think about, how do you have a bigger impact, a more equitable impact in the world? Well, we build it here and we export it. Now that's commercialization, which in healthcare is like an evil word, but I think about it like that's the only way a patient would ever get to benefit from an innovation, or an idea is that it actually gets turned into a product and brought to market. So changing our mindset, and realizing the power that we can harness here in BC.
Thank you. Thank you, Brian. Thank you, panelists. I have to say that lots of really incredible themes. You guys all add a different color to similar ideas, but really providing us the opportunity to think differently, think broader. Figure out which character are you in the Wizard of Oz. Thank you, Don, for bringing that analogy forward. And let's push on that. So without further ado, thank you very much, and for a hand to my panelists.
Thank you, Mike. Thank you, panelists. What a great way to start the morning. Really appreciate it's a complex conversation to have. And when we think about the fact that truly equity is the only acceptable goal in healthcare and really in anything, we have a lot of work to do. But when we think about who the panelists that are here working on it, I feel pretty safe to say that we've got the right people in the right places to make some decisions.